got our masks, but that's not all we need to do to stay healthy. Dr. Kristen Bishop of Keystone Natural Family Medicine talked to me about how important it is to boost your immune system, especially if you're traveling. All right, Dr. Bishop, it's so amazing that we have you on because we were just having this conversation with most of the cities and pretty much all of Arizona going to wearing masks, and that how you got to make sure that you are keeping them clean and some of the things that go along with that. Let's talk about, the mask and how important it is to have on and also to clean them.
Absolutely. So masks, as you know, can harbor different microbes if you don't clean them effectively. So that's super important because we're trying to prevent illness, and so if you're not cleaning them, you could be creating illness, which we don't want. The best way to do that is in really hot water every day at least. And if you can't do that, there is some research that shows that leaving them out in direct sunlight for about an hour can definitely be helpful.
So
the other thing, as you mentioned, is prolonged mask wearing can reduce your oxygen rate a little bit. So I highly suggest that when you get home, you do some cardiovascular exercise just to kind of re-energize those cells and get some good oxygen going.
So, okay, our immune system, that's what we got to talk about. That is so important. I've been preaching it to all my friends, to my kids, to everybody. You got to take care of that immune system and boost it.
Absolutely. So I would say, if you ask me like what were the top 3 things you could do, supplement-wise, I would say most of the research points to vitamin D, zinc, and vitamin C. I think those 3 things are super important just to make sure your immune system is optimally functioning. As far as recommendations on how much to take, make sure you visit with your provider and they can get you that information.
Yeah. All right, we're getting ready to do summer travel, and that's something that we have to really watch out for. And you have some great tips on us to be very health conscious when we're traveling.
Yes, and as 4th of July is coming up, we're kind of fortunate that most of the 4th of July celebrations are outdoors, which is one big thing. If you can be outside where you can spread out a little bit, be in fresh air, that's always going to be a healthy option. And pool parties are also a great way to go because we know that viruses don't typically spread throughout the water. So if you can be outside and stay apart and eat healthy food, you should be good with travel.
So, all right. Parents right now are kind of nervous. I've seen letters go out to asking them how they feel about reopening schools. Let's talk a little about that because I know that's going to be on everybody's mind in the next couple of weeks.
So fortunately, children aren't very affected by the virus. A lot of countries, the research is showing that children under 9 are hardly effective at all. And schools, even based on the Arizona Department of Health Services, seem to be a pretty safe way to go. So we do have that in our favor. But I think it's really vital to teach children how to wash their hands properly. I don't think a lot of kids know that. I think we need to be somewhat cautious with hand sanitizer in small children because the CDC a few years ago had kind of asked us to limit that because kids have a tendency to lick their hands, and ingesting hand sanitizer can have a lot of really bad effects. So I want parents to keep that in mind. And I think do all of the regular precautions, and I think we're going to be safe to go back to school for sure.
Yeah, we've seen people's insurance kind of get either dropped or they've cut it a little bit. You guys are doing something because you want people to stay healthy.
Absolutely, yes. We've been running something called a direct primary care model for about 5 years now. And what that is it doesn't rely on insurance. So sadly, you're right. People have lost their jobs and then in turn lost their insurance, it's never a good thing to lose your job, but it especially is really harmful to lose your insurance and access to your primary care physician during a pandemic. So the model that we have doesn't rely on insurance, so people could pay a flat monthly fee and have access to their doctor whenever they need them.
So great. And how can people find out more, Dr. Bishop, about your practice?
Well, you can visit our website at www.keystonemedicine.com or give us a call at 480-535-5688.
All right. Thank you, Doctor.
Thank you, Brad. I appreciate it.